Friends, we are discussing the topic regarding how to describe the gross specimen when you receive the specimens in the histopathology laboratory. The first step to describe the specimen is the steps and the components. How will you approach to new specimen received in the histopathology lab? So mostly you will receive the specimen from the surgical department like general surgery department, ENT department, oncology, oncosurgery department, bone marrow biopsy from hematology department, and gynecology, ear, nose and throat surgery, and ophthalmology department. Also you receive the biopsy from the skin department. So first thing you want is the requisition form along with the gross specimen. You receive the form with the description from a surgeon. So here you have to describe the status of the specimen. So mainly the status of the specimen when we describe, you can see whether it is the fresh specimen when you receive immediately from the OT, or it is of the how much hours has been elapsed, how many hours has been elapsed after the surgery, and when you receive the specimen in your lab. Mostly you receive the specimen in 10% buffer formalin. So that is the formalin container in which we receive the specimen. Which are the other fixatives? Sometimes you receive that specimen in the Bowen's fluid, so that is also the fixative which you use. If you receive the specimen for frozen section, then you receive in the normal saline that you receive for the frozen section. Time of surgery is very important because you know the cold ischemia time, which is important parameter in immunohistochemistry if you want to do in the oncology specimen. So you should identify the specimen by at least two names, two markers. One is the patient's name and second one is the registration number. uh, you have to identify the anatomical site along with the gross specimen. So then after that, you when you do the grossing, describe the specimen as: we have received the specimen of uterus with cervix with bilateral adnexa, or if it is without bilateral adnexa, that is both ovary and tube from both the sides of the patients. Also you can write the name of the specimen, name of the operative procedures like received specimen of bilateral salpingo oophorectomy, received specimen of laryngectomy, received specimen of esophagectomy, received specimen of stomach, or received specimen of the testes. So likewise you can describe in the gross appearance of the specimen. You should write whether the whole organ received or the part of the organ is received. That is very important because when you receive, sometimes like in laparoscopic hysterectomy, do you receive the fragment of the organ like the uterus, fragments of the uterus. So you receive the fragment of the uterus and you should identify the endometrial cavity in such specimen by dissecting all the fragments. Otherwise, sometimes it is difficult to identify the abdominal endometrial cavity. You should receive the specimen when it is the cyst like structure, whether the cyst was ruptured intraoperatively or postoperatively, or you have put the incision on the cyst and the cyst fluid is coming out. In oncosurgery specimen, sides of the surgical margin is very important. So you always remember S for S, that is short superior margin and long lateral margin. Also, you have to do the weight of the organ and measure the organ in 3 dimensions, that is the length, width and the height. If it is liquid specimen, then measure the quantity in the milliliter or other SI unit. Now we describe the main findings of the specimen, that is the measurement of the surgical resection marking from the original tumor site if it is a oncosurgery specimen. Then describe the shape of the specimen, round, whether it is ovoid, spherical, elliptical, cystic, multiloculated and linear or fold. Color, describe the color of the tumor like grayish white, whitish, pink color, tan color, yellowish white. So likewise you can describe the color of the specimen. Then describe the consistency of the specimen, whether it is soft or firm, soft to firm, friable, rubbery consistency, liquid in consistency or the structureless. If the order of the specimen, whether it is decomposed specimen, particularly in the postmortem examination, you receive the specimen in decomposed state, that is the foul smelling specimen. Also identify the normal structure if you received along with the pathological part, that is the secondary pathology or the normal structure like polyps and second smaller lesion diverticula, and also identify the lymph node, and you have to calculate the number of the lymph node in the gross specimen. Describe the specimen whether it is capsulated or non capsulated. Do inking, that is the important part of the specimen. There are various margins, so you can use the different color of the ink, that is the superior margin. As for sky blue color, inferior margin, that is the green color, that is the color of the grass which is inferior, so you can remember in that way. Then the medial margin, that is the red color. Then the lateral margin, yellow color. L of yellow is lateral margin. Then deep color, very colorless structure, that is the black color. So deep margin or posterior margin, and the anterior margin, that is the orange for anterior, that is the prototype. Always make the habit of taking the photographs before excising or before putting the incision on the specimen. Also report or review the radiograph cytological findings, crust smears, and the imprint cytology if you want to take from the tumor specimen. Tissue disposition is also important, whether you submit the entire organ. If it's entire biopsy, it is very small. Representative structure submitted and total number of the cassettes used in the specimen. Also give the label the cassette with the unique system of reporting in your each laboratory. So this is how you can describe the specimen. Also from various websites you can see the prototype, that is the prototype template for various grossing template for various oncosurgery specimen, and you can use the various protocol like the cap protocol. You can, it is easily available in the cap sites, that is the College of American Pathologists. So you can use that protocol also, because why the gross diagnosis is important, because the histopathological diagnosis mostly 50% it is the gross diagnosis, that is very important. So College of Opening, they give the various tumor grossing protocol. So thank you very much for this short video, and if you want, like, subscribe my channel and also share the video.